You're listening to the Food City Podcast, the show that takes you behind the scenes of your favorite supermarket.
From new products, expert tips on meal planning, and all things community, let's dive in and see what's in store today.
Hello. So we are talking about American Diabetes Month, which happens every November to encourage awareness about diabetes, talk about prevention and management. So going into it, I think maybe starting off talking about what is diabetes, defining it, and then some tips for managing a diagnosis through food and lifestyle and medication, and then maybe even some prevention tips, healthy eating for general.
Yeah, and I think diabetes for Americans specifically is becoming so much more prevalent. And you mentioned the types or diagnosing diabetes or symptoms. When we're talking about diabetes today, we're predominantly going to be talking about type 2 diabetes, which we recognize is typically related to our diet and lifestyle. So things we're doing every day, our environment, our eating, our activity. Not as much about type 1 diabetes, which is oftentimes called juvenile diabetes, which is going to come from a genetic component. Still have to modify diet and our lifestyle, but what we're going to be focusing on is more related to the insulin sensitivity of type 2 diabetes. And I think when we think about people coming to our stores to shop at Food City that are diabetics, we really want to give that perspective today too of I have this diagnosis where I know I need to modify. What are some things I can do to kind of manage that? And both of us coming from kind of that clinical background, do you want to walk through some classic things that maybe might be signs or symptoms of diabetes or things that information you might get from your physician around that?
Yeah, absolutely. Well, I think first off, you mentioned type 1 being oftentimes called juvenile diabetes because we used to associate type 2 diabetes with, later adulthood. Children don't get that while they might with type 1. But we're actually seeing a higher prevalence, not just in adults, but in children as well. We're seeing earlier onset of type 2 diabetes. And so a lot of, how your doctor might diagnose you is looking at your A1C, so glycosylated hemoglobin, which is a long kind of fancy way of saying your average blood sugar level over the past 3 months. Typically, it's an average over 3 months. And so if that is in a range that is higher than what we would expect, you might be first diagnosed with prediabetes, and then later that would be an indicator that later it might develop into type 2 diabetes.
Yes, and I think the common misconception is that obviously when we talk about blood sugar, that's literally glucose or available energy in the bloodstream. And the reason it's not a good thing to have too much sugar in our bloodstream is that it can cause complications to other areas of the body. So when I used to see patients, I would explain it's not one high blood sugar that's causing the risk. It's if they stay elevated. And some of those complications, it's kind of weird to think about, but sugar's sticky. And so in that bloodstream, it gets very sticky. It can make blood flow more restricted into areas, especially where we have really small blood vessels. So thinking about that, that's like our eyes, our kidney, our heart, and then neuropathy that affects our hands and feet and our extremities. So if you're somebody who's younger or your family history of diabetes where you're like, my grandma had diabetes, my husband or other loved one has diabetes, and you feel like it's more normalized and maybe saying my A1C could be better, but I'm managing the best I can. I really encourage people when you're thinking about long-term health, the complications are really what we want to prevent. And the best way to do that is by managing those blood sugar ranges. And then to your point, that A1C, you crushed that also, pronunciation. That's why I kicked it to Nicole.
I was a little bit nervous.
Yeah,
with
I'm going to let her
pronunciation,
tackle that one. But that's a good metric because we see blood sugar ranges going up and down throughout the day. It can feel overwhelming, having to track and check. That's going to be the best indicator for your doctor, you and your pharmacist to work together on how you're managing that progress. So becoming aware of those numbers, getting a target, that can help you realize, are the things that I'm eating and the behaviors I'm doing actually impacting my blood sugar? Because eating for health and eating for blood sugar management, they do have some overlap. But I think there's a lot of misconceptions around eating for diabetes.
Yes.
Do you want to maybe kick things off, starting about some common ones you hear?
Well, I think, first of all, you just gave such a beautiful overview and really distilled it into easy to understand visuals. In your average patient, you mentioned or alluded to insulin sensitivity and insulin resistance, which is kind of going to be an indicator of later on maybe type 2 diabetes development. But typically what we would like to see is blood sugar going into your cells. And insulin is that key that unlocks the cell that allows glucose to enter in. And so something is off, we know, if blood sugar is staying elevated over that and indicated by that A1C. Now, talking about kind of managing a current diagnosis of diabetes and talking about some of the misconceptions, I think a lot of people feel overwhelmed with a initial diabetes diagnosis. You hear about the complications. Perhaps you have a family member who suffered some sort of vision impairment, in rarer cases, even an amputation. And so it's a very scary diagnosis. However, it can be managed with your diet, and it is up to the patient, of course, diet and, of course, medication management and speaking with your physician. But initially, you may go into panic mode and think, I need to cut out all carbohydrates or all sugars. And eating sugar is what caused the diabetes. I think that's probably one of the biggest misconceptions when it comes to especially those early diagnoses. What about you?
I think the big thing that happens when we get into that insulin resistance or insulin sensitivity, the way I used to kind of explain this in simple terms is that your body has a preferred way to manage energy. And once you tip into diabetes, you're no longer signaling or hormone response in a normal way, which means you need to do everything you can do to help regulate that system.
Yes.
So meal consistency and meal timing is a big piece of that. And a lot of that is that our blood sugars are going to vary up and down throughout the day. We should eat a meal. Our blood sugar should go up. Our body should process those blood sugar or energy. And to your point, it should go into the cell. Our bodies are so smart, and if we go prolonged periods of time without eating, it has the ability to release stored forms of sugar into the bloodstream to keep our body level and energy there, right?
Yep.
When we have diabetes, it's not good at saying, oh, blood sugar's already high. So we see this kind of response where people are like, I didn't eat for 5 hours. How is my blood sugar still elevated?
Yeah.
And that I think becomes a lot of the biochemistry. It is quite complex, and everyone is a bit different, but we recognize getting on a regimen of eating the right foods at the right time in line with your medication is going to be the best way to get that A1C or blood sugar average down.
Yep.
And I think that's why it's the hardest, because unlike some of our other disease states we manage, we have to eat multiple times a day. I have to think about measuring and reading labels. So I think people get a little bit of burnout over time learning to manage this disease, and especially if those numbers aren't immediately following to normal levels, I can imagine it's a little disheartening.
And that's where it seems easier and more intuitive to just cut it out completely.
Yes.
You don't have to do any math or calculations or measuring for portions. But you talked about meal consistency, eating kind of a standard number of carbohydrates throughout your meals throughout the day. Carbohydrate counting is what this is typically known as. It's often prescribed by providers to patients with diabetes to help manage that. And of course, it does look at the amount of carbohydrate in a certain food and divides that into units of 15 grams of carbohydrates per choice or per serving. And then typically you'll be recommended to eat a certain number of servings or choices at each meal for optimal blood sugar management. Now, of course, this can work for non-insulin dependent or insulin dependent, but it will, of course, need to be dosed according to your insulin.
Yes, and your, again, activity. And I think when people think about carbohydrates, even that word gets a little confusing. And
Sure, yeah.
just because a food contains carbohydrates does not mean that it's an unhealthy food choice. Some quick ones we think about: all fruit are carbohydrates. They contain natural sugar. Milk and dairy products are typically going to contribute a carbohydrate serving. Grains, pastas, rice, any of your starches or grain-derived products are also going to be in that arena. And then, of course, we have regular table sugar or concentrated sugars like honey, maple syrup, although they're natural, those still are going to be in that. And then any of their derivatives, right? So like fruit juices, dried fruit. So I think when people start looking and they're like, I'm eating no carb, they recognize, well, what does that leave me with, right? So taking ownership of saying it can be really unfamiliar and really underwhelming, but figuring out, one, what foods in my diet are contributing to impact my blood sugar, and then what does a serving look like? And I think, again, in counseling, we've kind of mentioned this a few times, that would be one of my first things. I would say, do you know what a serving of rice is? I'm like, this isn't a trick question. Probably the answer is no, and that's okay, but it's that second step of let me analyze how to manage that portion of the plate.
Yes.
And do you want to talk a little bit about what we call the diabetic plate method or the American Diabetes Association, kind of what that method entails?
Yes, and I love this because it is a visual tool that I think is just a little bit more intuitive. You may not necessarily have to measure every single thing, at least if you have a good understanding and have familiarized yourself with generally portion sizes, especially of carbohydrate foods. But the plate method divides the plate into 3 different parts. And so a quarter of that plate is for a protein, preferably a lean protein choice, of course. So that might be depending on your own specific needs, calorie needs and protein needs. It might be about a 4-ounce serving. And then a quarter of the plate would be for some sort of starch or carbohydrate choice. Now, this differs from what we call the My Plate model because it does include fruit and dairy on that plate because those contain carbohydrates. And then a half of that plate is for your non-starchy vegetables. So non-starchy vegetables are going to be very low in carbohydrate, high in vitamins and minerals, of course, like all vegetables, and then they're going to be relatively low in calories as well. And that includes things like your broccoli, cauliflower, celery, leafy greens, carrots, and celery.
I think
could go on.
The core theme of these podcasts, no matter what our topic, somehow comes back to, are you eating enough vegetables?
Are you eating your veggies? Yes.
And that's the intimidating component, I think, for a lot of people is 2 things. One, I need to figure out what the carb foods are that I'm aiming to find the right portions for me. But on the flip side, if you're somebody that's eating a lot of fast, quick, easy carb meals, when you try to restrict that, you're like, well, that's not enough nutrients or fuel. So that's the importance of the plate method for people to focus on things like your protein choices you mentioned, your non-starchy vegetables that aren't going to impact your blood sugars as much. They're going to help you stay satisfied. They're going to give you some of those nutrients and fuel. And then it's easier to manage the portion of the carbs.
Yeah.
I think if you get caught up on what you shouldn't be eating, quote unquote, then that kind of becomes more intimidating or sets us up for that restrictive mindset. And we kind of mentioned this earlier, like you were saying, there's a lot of topics about should diabetics be eating concentrated sweets at all? Like, should, those things. The big thing is figuring out a way for you to recognize the carb foods and find a diet that works for you or a lifestyle in the long term for blood sugar management. And that's where I think some of those extreme restrictive things, people feel empowered and great. They see good numbers for a few months, but they recognize this is a lifelong disease. I need to find a more long-term manageable way to eat to keep the blood sugars within that range.
Yes, absolutely. You mentioned a lifelong disease. I think a lot of people think that if your A1C comes back down, that means your diabetes is cured. Unfortunately, that is not the case. It really is lifelong management of those blood sugars. But once the carbohydrate foods have been identified, you've identified what a portion size is and kind of how to balance that plate, how many portions of carbohydrate you're actually going to put on that plate. I think the next piece of the puzzle is prioritizing those quality carbohydrates. And by quality carbohydrates, I of course mean things that are going to be higher in vitamins and minerals, but also higher in fiber. because fiber is going to kind of blunt the impact on your blood sugar. It's going to kind of release slowly, and starchy vegetables, that is also going to cause, generally speaking, for most people, a more slow release of blood sugar into the bloodstream.
Yes, and that's actually when you really, I think, commit to managing diabetes through diet and checking your blood sugar levels. You can eat the same amount of carbohydrates, but your body's response can be very different.
Yep.
And a lot of that deals with some of the other, what we call macronutrients, protein you have on the plate, fiber you have on the plate. And I think something we spend a lot of time on with Food City is thinking about how, when people are in the store, because really when you come to the grocery store, it's kind of the power of choice. I think that's what's so fun and exciting, is like there's so many different brands and different flavors, and it meets such a large community's needs of what their health and nutrition or just food enjoyment means to them, but it can become very overwhelming. So we really work through our shelf tag programming online and in store to try to say, if you're a customer who's saying, I'm being told by someone to eat more whole grains, and they gave me a list, but when I get to the store, it just becomes so overwhelming.
Yeah.
Those are some of the tools I think we've really worked to develop and think about. If I was a customer or I was giving guidance for this disease or lifestyle management, what would be beneficial for those tools to have in place? Do you want to talk a little bit about kind of how those tags work and which ones might work best for diabetics?
Yeah, absolutely. Well, Pick Well program, I absolutely recommend it if you're shopping in the stores or online. But a few of them the first one that probably comes to mind for most people when they hear diabetes is the CarboWare tag, because this is identifying foods that we would call low carbohydrate. So each food or each product that has the green CarboWare tag is going to have between 0 to 7 grams of carbohydrate per serving. This allows you to easily kind of count carbohydrates or kind of take into account how much you're actually consuming. However, it's not necessarily going to identify or take into account the amount of fiber in a food, or even whether it's nutrient dense in terms of their vitamin and mineral content. It's not going to regard saturated fat intake either. And so pairing that with one of like the dietitian's pick or even the heart healthy tag, that's going to ensure more nutrient dense choices. It's going to take into account saturated fat intake, because we know that one of the comorbidities for diabetes is heart disease.
Yes.
And with that, high cholesterol and high blood pressure and stuff like that. And so really choosing those nutrient-dense choices as part of an overall balanced diet is going to be key.
Oh, absolutely. And I think whole grain
Yes,
is another similar one where it's going to let you know that that item contains whole grains, but you do need to do that second layer of investigation to say, okay, sugar content, things like that need to also be taken into account. And I think it's interesting. You actually brought up a really good point about we teach people diabetic diet, and then we also say, oh, wait, but you also need to follow a heart healthy diet.
Yeah.
And I think that that's, again, where we get into that continuum of how do I decide what is of most important? It is very individualized. And I think that's sometimes you get diabetes resources and things that are like, here's all the carb foods you can eat. And people say, just tell me what to eat, right? But I think that that's a really nice tool to kind of keep in your arsenal, is saying if you're looking for better for you choices, that Pick Well, especially, again, dietitian pick and heart healthy, is going to give you those options that typically align more with that preventative-based eating style. And then, I think we talked a little bit about no carb eating today, but a lot of, newer research and things, we're always going to use the American Diabetes Association. What do their guidelines say about best prevention and how to manage? But I do think people are exploring lower carbohydrate diet, especially linked to weight management.
Right.
We recognize another big side of diabetes management, and then again, prevention of complications, is movement and activity. And of course, reduction in weight typically helps from a hormone level to improve our insulin sensitivity.
Yes.
So those are some other pieces of that puzzle. I think we're focusing more on the food and nutrition component, but that do play a role into, again, that blood sugar response.
100%. I think even just taking a walk immediately, you mentioned the exercise, so this is why I bring it up just in a little bit more detail, even if we are focused mostly on the food aspect. But, after eating a meal, going for a walk or doing some form of activity after is a great way to manage your blood sugar levels afterwards. Another benefit of exercise on those hormone levels, of course, you talked about improving insulin sensitivity, and resistance training especially is going to help with that, building up muscle with muscle strengthening exercises like weightlifting or even just weight-bearing activity in the gym.
Makes a huge difference, yes. Mm-hmm. And again, we've brought up a lot of different components. I think if you're somebody out there who's wanting to, make movements or make steps for yourself or for loved ones of giving them guidance for managing their diabetes, typically the best thing to think about is one or two small things and we say that a lot, but I think it rings true for this. So if you're skipping meals, maybe your goal is to eat 3 times a day. And then you're going to practice the carb counting. How many carbs am I getting? And then you're going to look at the quality. And then you're throwing in your walk afterwards. So it's a pretty long list when we look at the management side, but recognizing the whole goal of focusing on diet and exercise along with medication support is that if you get those first 2 things going, your medication support can be diminished over time or doesn't have to be as prevalent. And the long-term complications. So again, our thing that we are seeing trend is younger adults, younger people being diagnosed with this disease. And that means the likelihood of you developing a complication over your lifetime increases. Mm-hmm. So I think, we share a lot of generalized wellness tips. They do apply somewhat to this unique perspective of diabetes. But is there any other key things you kind of want to share today or any other things you feel like we didn't kind of get to go into? I know we gave a broad overview, but...
We did go into a broad overview. I mean, I think we talked about the quality of carbohydrates and briefly alluded to, pairing it with protein. But again, that meal balance is also going to be key to impacting blood sugar. So making sure that you're not just eating carbohydrates by themselves, but you're eating it with the protein and that's where that balance plate just kind of is an integral part of meal planning. But I think another important aspect, obviously, is talking with your provider and remembering that there is no diabetes diet that works for everybody. So that's why testing your blood sugars regularly is so crucial, because you don't necessarily know how your body is going to react to a specific food until you do that. Speaking with your provider on maybe some strategies to manage that.
Yes. And I think, again, we recognize a lot of times people are looking for support, looking for ideas. The individualized component is, I think, what makes it hard at times. You got to find what works for you. But if you're looking for more resources from Food City, some things that you can check out is our diet and lifestyle landing page at foodcity.com. We actually have a whole section there on how to tackle low carbohydrate eating in a healthier, more balanced way. You can access all of our Pick Well tags to easily shop all of the items that are eligible for that. And if you are not a member of our wellness club, that is where you're going to get that monthly newsletter providing insight from both our dietitians and our pharmacists, which we didn't touch on pharmacy today with this, but they are such a huge ally in that blood sugar management, understanding our medications, so using them as a resource in our food cities. It's just a great thing. Full picture so you can feel some more of that health support and information from Food City.